Well, today Pfizer made the request. Gabrielle Harmon spoke with a local infectious disease expert to find out when we may see kids starting to get that shot.
I mean, we're not talking months, but we're talking more so weeks as far as the decision goes.
On Thursday, Pfizer officially asked for emergency use of the COVID vaccine for kids ages 5 to 11. Dr. Mark Burns, an infectious disease specialist with U of L Health, says the vaccine is already safe, but it's the dosage that matters for kids.
They found that with 1/3 of the adolescent and adult dose, they can get a robust immune response in the children.
Parents like Anissa Marshall say even though she herself got the vaccine, she knows some parents are not so sure just yet.
For me personally, I gave all my kids the vaccine, so I would probably consider it, but I just feel like it's so young.
Right now, the only COVID protection for kids 5 to 11 includes social distancing, washing hands, and wearing a mask.
And my wife and I have talked about how much harder this would be for us if our kids were going to public schools right now.
Louis Single is visiting from out of town with his family. Like Marshall, his kids are also not old enough for the vaccine. However, he says if they were, they would be getting it.
But there's a lot of people out there that are susceptible to it, and I don't want my kid to be a vector for the virus to accidentally, get somebody sick. And that could be at the grocery store. It doesn't even have to be family,
Both parents encourage others to do proper research. As for the emergency request, if and when the FDA approves, it will go to the CDC's Advisory Committee on Immunization Practices, and if they sign off, the vaccine would begin rolling out for those ages 5 to 11.
The FDA is scheduled to have a hearing on October 26th. A panel will publicly go over data that's been collected, and a ruling is scheduled to happen sometime between Halloween and Thanksgiving. In Louisville, Gabrielle Harmon, WHAS 11 on your side.